In this video, we are going to talk about irreversible acetylcholine esterase inhibitors. These are basically not the drugs, but these are poisons which usually people consume, like farmers who consume organophosphates, and because of this, there will be various effects. So, by studying about irreversible acetylcholine esterase, we will be able to treat it. So, organophosphates include malathion, parathion, DFP, tabun, serine, whereas carbamates include carboxyl, carbaryl, and propoxyl. Okay, what is the mechanism of action in these drugs? These compounds block acetylcholine esterase enzyme. So, because of that, there will be too much of acetylcholine in the synapse. If there is too much of acetylcholine in the synapse, this will lead to activation of M1, M2, and M3 receptors, which will in turn lead to increase in hydrochloric acid, decrease in heart rate and blood pressure, and pinpoint pupils in the eyes, increased secretions in the glands, urinary incontinence in the bladder, diarrhea in in gastrointestinal tract, and bronchoconstriction. How do we treat this organophosphate and carbamate poisoning? First, starting with organophosphate poisoning, atropine is the drug of choice. Atropine is a drug which is a muscarinic blocker, that is M1, M2, M3 receptor blocker, and hence it is used for organophosphate poisoning. It is given by IV route every 5 minutes once till there are signs of atropinization. What are the signs of atropinization? Decrease in the secretions, mydriasis, and heart rate rising more than 100. Along with atropine, we can also use acetylcholine esterase enzyme reactivators. These are called as oximes, namely pralidoxime and diacetyl monoxime. Pralidoxime is most commonly used and it acts only peripherally, whereas diacetyl monoxime acts centrally. We have to note that oximes are not used in carbamate poisoning. It can only be used in organophosphate poisoning. So, what is the treatment for carbamate poisoning? It is atropine as a drug of choice. Along with that, symptomatic management.